Hello, I'm Catherine Turner. I'm one of the exec managers here at the Primary Health Network. At the moment, my role is leading a team who are working on our recovery from the COVID outbreak and doing some work on planning ahead for the future. The Capacity Tracker was brought to us as a potential tool to assist with our COVID coordination, and at the time in the peak of the outbreak, people were very much reaching out for something that would connect various parts of the system. So the Capacity Tracker was exactly what we needed at the time, and for us it's really being able to help us improve our local coordination and answer the question about which general practices are connected to which residential aged care facilities, and as well as improve our relationship with the aged care facilities and assist them with the many challenges they're facing. We worked on the What's in it for me principle, so we made sure we had key clear communication messages that really demonstrated the benefits for groups of stakeholders. So we had one set of messages for general practice, another set for residential aged care. We also worked really closely with the local health districts and the public health units to demonstrate that this is a system that can complement all of the other systems that were gathering various bits of information, but to bring everything together for that one source of truth. Yeah, it's interesting. I like the maps. I like being able to visually see where the general practices and the aged care facilities are in relation to each other. And you can definitely demonstrate that through the maps and the various reports. So that aspect's been really very positive for us. It's really easy to use. It's really easy for the stakeholders to register and then keep their information updated when things change. But the thing that surprised me is the feature that the resource centre, where we are able to update the information that's in the resource centre and make sure that people have a sort of a dashboard that takes them to the most current information. It's curated by us, but it's the most current and recent guidelines from the Commonwealth, guidelines from New South Wales Health, links to health pathways, links to the education resources, links to our YouTube channel. Everything that somebody might need, particularly at the moment related to COVID, is there at the click after one click. And we've had really positive feedback about that. It's really helped us answer that question about the connection between general practice and residential aged care. So at the time we were watching things that were happening in other parts of the world and then other parts of Australia, and really acknowledging that not knowing what the relationships were between those facilities and the challenges that would be faced if one or other had service disruption was really worrying for everybody in the system. And the Capacity Tracker has really been able to take away a lot of that worry for us. And so at the moment it displays minimal information, but we've built into the system a number of things, including the ability to keep who's the emergency contact for each general practice and for each aged care facility. So we're really going to be able to respond in a much more cohesive and quicker. We're going to be able to respond quicker when required to assist with that system coordination. And at the moment we're setting it up to deal with infectious diseases outbreaks like COVID, but we would have loved to have a similar system during the recent bushfire system, after great storms where there's electricity outages for days. You know, Australia has lots of other challenges around floods. So yeah, we think it's going to really assist with our disaster planning. Do tell people about Capacity Tracker. So we've been invited to speak to a number of the other PHNs and also primary health organisations in New Zealand. So my message is it's a simple value for money tool it's really been a benefit for us. It's easy for stakeholders to use. It's been an interesting exercise for us to build the system for the Australian purpose, and it will be something that continues to demonstrate how primary health networks can really provide some added value for residential aged care and general practice. Yeah, it's an important one. You need a very clear project team, which we didn't necessarily have at the start because we were all responding in a very reactive manner. But now we have someone who monitors the alerts as they come in so that we can respond to those. We have the primary care improvement officers are ready to respond to the general practice alerts, and we have somebody who responds to the residential aged care facility alerts so that everybody knows if someone reaches out, the support is ready and coming to them. The other thing is we've had to have assistance from our IMIT team to continue to build on the reports and the improvements in the background. So for us, it's just been about making sure that everybody who can assist and who is getting some benefit for their role from the capacity tracker is involved. My top tip is to make sure we've got very clear messaging. So right at the start, understand why you're implementing this system. Be really clear that yes, some of the features do look like features of other systems that people are using, but be really clear about why we're bringing in an additional system to provide that coordination over the top. Don't make it too onerous for people, but make sure also that if people reach out through the alerts, that we are absolutely responding as we say we will, and that they're getting the benefit that they need. The patients wouldn't know necessarily that this system was in play, but we have been able to utilise the maps and some of the information when aged care facilities have struggled to find GPs to take on new patients. So we have actually been able to use that to assist with finding GPs for patients, so that patient experience will definitely be improved. And it does take away the challenge of sometimes beds in aged care facilities can't be filled because there's no GP to look after the patient. So if we use this system for that, which we haven't been doing in the past, then that's going to be a huge benefit for patients.